There are many ways to keep you and your family healthy for the future. We want to talk to you about ways to prevent diseases and stay healthy. Depending on your age and medical history, your provider may offer you screening for heart disease, cancers, and infectious diseases. For example, your provider may recommend a cholesterol test to help prevent heart disease, or to test to detect early signs of susceptibility to cancer such as colonoscopies, mammograms, pap smears, and prostate examinations. Your provider may talk to you about tests for infections such as tuberculosis, sexually transmitted diseases, hepatitis, and HIV. Both the Centers for Disease Control and Prevention and the Pennsylvania Department of Health recommend that all patients aged 13 to 64 who are receiving medical care undergo voluntary and confidential HIV testing. HIV is the virus that causes AIDS and is treatable but not curable. A person may become infected with the virus in many ways. HIV may be spread by not using a condom during vaginal, anal, or oral sex. Unprotected sex greatly increases one's risk of contracting HIV. Infection can also spread from blood-to-blood contact, such as the shared use of needles during piercings, tattoos, and drug usage. A mother may pass the virus to her child during pregnancy or breastfeeding. Proper treatment can lower the chances of this occurring. What answers will testing provide? Well, if your test returns a negative result, no sign of the virus was found in your sample, you can learn ways to prevent ever becoming infected. If you have a positive test, then you are infected with HIV, but can receive treatment and learn to avoid infecting others. The only way to know the answer is to get tested. Let's take a look at how the test is done. The test is safe and involves one or more of the following samples from a person: blood, oral swab, or urine. Your provider will explain which specimens will be needed and when the results will be available. Also, keep in mind that HIV can take 3 to 6 months from exposure to appear in your samples. So if you've had unprotected sex or shared needles or works with anyone in the past 6 months, a follow-up test will be recommended in 3 to 6 months. Usually a single screening is enough, but occasionally a second specimen may be needed to complete testing. Depending on the type of lab testing, your test results could come back as reactive. This occurs when a rapid test is done and the result is not negative. This does not mean you've tested positive and have HIV, only that a second test must be done. If your results are negative, you'll receive information on how to avoid contact with the HIV virus. If positive, you are infected with HIV, but can begin treatment and also learn to prevent spreading it to others. It is important to mention that on very rare occasions, the test may give a false positive or false negative result. If you've tested positive, your first question may be, now what? Your healthcare provider will make sure that you know how to get medical care and treatment for HIV so you have the best chance of leading a healthy life. It is important to know that state law protects your confidentiality of your results. The Pennsylvania Department of Health will use your results to ensure that you're offered the proper treatment services. Unless you sign a separate consent form, your results will not be released to any other private or government agency, partners, or even your family. The Pennsylvania Department of Health may contact you to discuss linking you with treatment and prevention services and the importance of sharing with your sexual and drug partners their potential exposure. They will also report the results to the Centers of Disease Control and Prevention for statistical purposes, but will not include your name or personal information. If you are under 18, your parents or guardian will not be informed without your consent. However, the testing facility is required by law to report suspected child abuse. HIV is the virus that causes AIDS. It is treatable but not curable. Testing is voluntary, but it is important in order to help prevent the potential spread of the virus. Your healthcare provider might ask you about HIV testing today during your visit, since we believe everyone between the ages of 13 and 64 should be tested. If you would like to have an HIV test today, please sign the consent form or ask your healthcare provider. Your healthcare provider will be happy to answer any questions you may have. Free confidential testing is also provided at state-designated testing sites. For further information, contact the Pennsylvania Department of Health AIDS Fact Line at 1-800-662-6080 or at www.stophiv.com.